Hey guys, we are here at the Tuckahoe location. It's our second office. We're gonna show you what we do for shoulders. More specifically, we have a patient that we're gonna kind of film and document a 4-day treat. So come on in, let's take a look at the whole scene in there. But more importantly, let's see who's behind the camera. So say hi, Tamara.
Hi.
All right, look good. Very cool, so come on in. Lovely tiara. You'll meet her when you come into the Tuckahoe location, all right? So hang on with us, we'll go through the evaluation in a second. Okay, so we are here with a patient. We won't say who it is, but for filming purposes, he's actually has some real issues. So I want to show you guys what we would do for a shoulder patient. What are you worried about?
I can't live like really past like this motion hand.
Okay, how long has it been?
A month.
A month ago. And is it gradually getting worse? Why are we treating it now versus a month before?
It's getting worse.
It's getting worse.
Yeah.
And what makes it worse? What do you do?
Working out.
Okay.
Just like sleeping on my shoulder, or like just uncomfortable. And I try to like reach across, try to grab.
What other things on the lower level stuff, like dressing? Does dressing bother you?
Yeah.
What specifically?
Like taking my shirt off and on.
Okay.
Yeah.
Anything going on this side?
Not as bad, but I still feel like the same.
Okay.
I feel like a pinch.
Okay.
Here, like almost on the side of my shoulder.
Got it. So the million-dollar question for me to ask him is, once we get treated a couple of times, how would you know we're getting you better?
Main concern for me is like just working out hurts.
Okay. So I want you to see that you're getting better, because if you're not, then we want to adjust your treatment. So it's working out is your goal. What's the movement that you know every time you do it, it hurts you? Shoulder press, dumbbells, 20 pounds. Is that fair to say? So we went outside to do it right now, that would hurt.
Yeah.
But you can still push.
I can push better.
Okay, cool. So let's do a couple of things to see where you're at. Let's go ahead and lift up as high as you can. Keep on going. That hurt?
Just tight.
Come on down. And do that a couple of times. So I want the camera to watch his face. Does that hurt?
It doesn't hurt, but it just feels like I can't go like
Okay.
past it.
Got it.
That's like towards myself.
Okay, so let's see you go sideways. Thumbs up, okay? And slowly then go all the way up. What happens when you do? Is it get worse, the same?
It's worse.
Okay, so do it again. I want you to tell me when it hurts, literally.
Right there.
Uh-huh. Come on back. Okay, cool. So let's see how strong you are. Let's go thumbs up, arm straight. Okay, I'm gonna push. Let's leave that arm alone. Sorry. I'm gonna push down. Okay, don't let me push down. Hold it. Okay, that hurts. Sorry. You okay?
Yeah.
Okay, do it again.
Yeah.
Okay, hold it. Okay, so we know his deltoids are pretty good. Most people have strong deltoids, but they have weak rotator cuffs. So I'm gonna take a look at his deltoid. So isolate the rotator cuff a little bit. Hold it. Don't let me push. Ready? Hold it. Sorry.
Yeah.
Okay. So, you know, that hurt. I'll stop that. Let's go sideways. Thumbs up. Hold it. Don't let me push. Okay. And we're done with the assessment. I know he has some kind of rotator cuff stuff going on. For the sake of the video and some privacy, we'll leave it at that. We're going to continue testing, but we'll leave the video portion done for now, and then we'll get into the treatment of it. Okay. We're going to do a couple of things. The first thing we're going to do is definitely work on his scapular area. Massager. Be with my hands in a few seconds. We look at his shoulder as a whole, so we don't want only the rotator cuff to work, but make sure he has his scapular muscles working. So we did our first part of the hands-on stuff. We're still not finished with our treatment. Let's go ahead and see your motion again. As you watch your face, we didn't finish the shoulder treatment yet, but you can see that he has a little bit more ease in his movement. Just by working on the scapular area. You're okay? So let's go ahead and go into that. All right. So we're going to gonna do a couple more shoulder techniques, and then we're gonna retest them. Today, because it's the evaluation, we wanna make sure that he's not too sore, so we might not do so many exercises today, and then we'll follow up on his next session. So I'm gonna continue the process with my hands. I'm gonna get working on his scapular area. I wanna see a couple of things. You're okay there? I want to see his shoulder tip a little bit better. That's something I want to work on. He's got a couple of knots over there we want to definitely break up. So we'll get to it. Take a look at this muscle here. This is a huge knot. And what that shows me as a therapist is that he's working so hard in the wrong way that this muscle needs to be broken up. This knot is not on his good side, so that's hugely important. Where here is, and you can see it, a pretty nice knot that we want to break up. So we finished the treatment. I just want to retest to see if we made a difference. So go ahead and thumbs up to the side. Yep. Mention arm. Here, hold it up now. Good. Hold your push. Hold it. See that? Now hold it. Relax. Thumbs up. Hold it. Pops up. Hold it. So, what you guys saw with the before and after, that was one treatment, and you know, he doesn't have a tear, but he does have some kind of inflammation, a lot of impingement. Forget about the buzzwords. There was a before and after, and if we can just change the mechanism of the shoulder, everything else will follow suit, as long as we stop making him lift so heavy. Okay, so that's kind of one part of the hands-on treatment. The session is not over, but for the video itself, it is. I want to share with you guys what we're going to do. We're going to keep on following John and kind of document his treatments. We're going to go about 3-4 more treatments on documentation, on video, so you guys get to see how quick a shoulder injury can be changed. All right, so we're going to do one more thing. We're going to tape him, and then we'll work from there. To end with John's session, make sure that he has a lasting effect on the hands-on stuff we did. We're going to tape him. The tape, he can stay on. It can stay on for 4 days, 3 to 4 days. He can shower with it. What it's doing is to make sure that his shoulder is a little bit more stable and he stops his cycle of pain and weakness. Go ahead and just reach back. Pretty big deltoid upper trap. Let's go all the pins out, mark the body. Pinch your shoulder back. We don't always want to test them. He just got work done, so we don't want to irritate him. But just do your test again. Hold it down. Hold it. All right. So the purpose is that not to irritate him, but the purpose of the video is that if his shoulder's in the right place, it's not torn. His muscle could actually fire better. So this is a nice tool for him to continue his rehab without seeing us all the time too. All right. So that was kind of the evaluation day one. Our next video, when we follow up in about 2 days, is to do the same treatment, see if there's a before and after of how he feels, and then we'll work from there, right? So just another sneak peek for you guys to see what we do on a shoulder issue. All right, thanks.